participant came to know that something about the camel. So I am not going to in detail about the camel species. So everyone is know about the camel. We directly go to the major diseases of camel. Especially in camel, common dermatological problems means the diseases which affects the camel skin comes under the dermatological problems. They are the major diseases which affects like parasitic disease, camel mange. Mange is a very important disease when we talk about the camel. It affects mostly, if one camel is affected, then you can think that it immediately spread to the whole herd. So it is very devastating disease in camel. Although mortality is very less, but if man's infestation is there in camel, definitely it will affect its production and its health, everything, economy as well. Next one is viral diseases like camel pox, contagious ecthyma, which is known as ORF, and lumpy skin diseases. These are the viral diseases which also affect the skin and all systems of camel as well. These are the most common diseases. Some other diseases like bacterial contagious skin necrosis, dermatophillosis, in fungal ringworm, skin candidiasis, skin tumors, bites, wound caused by insects, ill-fitting saddles, skin abscess, chest bed abscess, and dermatitis in general, like allergy and infections. So the major diseases when we talk about the camel, the most important is camel mange, then camel pox, contagious ecthyma. These are the most common diseases, and one is trypanosomiasis, which is not mentioned here, protozoal disease. Like other animals, in camel also trypanosomiasis and SARA is also occurs, and which is most important disease when we talk about the in terms of mortality. Next, when we talk about the camel mange first, which is known as sarcoptic mange or scabies. In all other animals also, the etiology, as you know, same as in camels, just difference is variety, and it is widespread and highly contagious in nature. As we know, the any skin disease is contagious in nature. Contagious means if it is spread through contact with infected to healthy. Then economic and zoonotic importance, it is very important economically, because when it affect the camel, ultimately it reduce its production. Then it causes severe itchiness. When we talk about the scabies or mange, itchiness is the major sign, poor growth, low milk production, and even death in severe case in case of immunosuppression. One of the most common and important diseases in camel, this camel mange. It's caused by mite, Sarcoptes scabii, variety cameli. In next slide we will see. And more severe during winter and rainy season. It often decline during the summer, because in winter and rainy season the environment is very favorable for this mite. You can see many studies has been conducted regarding epidemiological and its histopathological investigations in many countries like Egypt. You can see in this slide 47.6% incidence in camel herd. Then this one is epidemiological investigation in sarcoptic mange in camel with special reference to treatment aspects. 28% they reported the incidence. Then in Ethiopia, they reported 31.5% of prevalence of this mange. When we talk about the etiology, it is caused by mite, Sarcoptes scabii, variety cameli, and transmission is direct and indirect contact. Direct through infected to healthy, and indirect through equipment or rubbing any places such as tree where the infected camel, due to itching, the mite maybe fall and that infect the healthy one. Mite can survive outside the body about 2 weeks, so prevalence of and its spread is so high. It prefers low temperature and high humidity. That's why rainy and winter season is most favorable for this. It this picture is showing its life cycle. I'm not going about the detail in life cycle. We directly move to pathogenesis. How this might infect and cause pathogenesis in the body. First, this might egg invade the epidermis, then burrow in the skin cells, and might excrete or secrete antigens. They cause inflammation and allergic reaction, which causes intense itching. Due to this inflammation, it is the first sign appears about 2 to 3 weeks after invasion of this mite, and other inflammatory and pathological systemic reactions will happen, and ultimately it will affect the whole skin body. Although the skin affected are different part affected differently, like the growing region is mostly affected, legs and abdominal region, mouth, they are affected most. After invasion, it will cause circulating oxidative stress, yani ki, that means the immune system and its oxidative damage it will cause in the cells, and it will ultimately cause the uh, structural changes in cells or skins of the body. Clinical signs, when we talk about the clinical signs, most important clinical signs are hair loss. That's why we can see in picture that due to hair loss and skin affected skins, the lesion can be easily appreciated. Start in the armpit and groin region, then it spread to the rest of the body, and you rub and scratch the affected area. That's why the secondary lesions like mechanical injury will be caused, and ultimately the secondary bacterial infection can be caused due to this injury. In early stage, the skin is covered with small bumps and hairless patches develop, and skin become raw and begin to weeps. These are the common clinical signs in camel. In later stage, the scab develops whitish gray, thickened, wrinkled, cracked skin can be seen in this picture, like leathery skin in chronic stage, because skin is also having its own defense mechanism. The hyperplasia and hyperkeratosis will occur. They will ultimately result in leathery, whitish, wrinkled skins. Due to this itching and other uh, lesions, ultimately camel will become anorectic, and it will lose body weight and become weak and anemic. And due to secondary bacterial infection, other infection may happens. So these are the most clinical signs. Now we move to diagnosis. How we will diagnose this? Like other animals, diagnosis is very simple. We will take skin scraping and putting it on the slide, 10% potassium hydroxide, so that debris and hair will be dissolved and mite will be appearing under the cover slip in microscope. It will be easily identified. Other method of diagnosis is history and clinical science, then serology, PCR, and differential diagnosis with other similar diseases like similar clinical symptoms, diseases like camel pox, ringworm, contagious skin necrosis. So diagnosis is not very difficult in this case. Then treatment is very difficult and expensive, because in any skin infections like in human as well, it is very difficult to treat because of the less permeability and bioavailability of drugs in skin. It is very difficult, and it will take time to treat. Then first we identify and treatments early stage, then it is comparably easy to treat. So we should keep in mind that we have to eradicate the disease completely. Otherwise, if one animal remains infected with mange, it will spread to other in coming time as well. So treat all animal at the same time. So the mite will be eradicated from all the farm at the same time. Treat both infected and healthy animals, as ivermectin is effective in this case. So we have to treat healthy animal as a preventive. Prophylactically, we have to give ivermectin to healthy animal as well. Move animal away from the area, and also shear the animal and scrape away the crust. Spray the whole body 2 to 3 times at 7 to 10 days interval. These are the some treatment method, like amitraz we can use, then deltamethrin, cypermethrin, then inject ivermectin. This is the most commonly used drug, 0.2 mg per kg body weight subcut. As other animal, similar to other animal in camel also, the dose is same. Then one other method which is mostly used and very much effective with simultaneous to ivermectin, we can give 6% sulfur powder in mustard oil. It is very effective in camel. Then caution we should keep that acaricides are poisonous, so we have to keep in mind during treatment. Then prevention of any disease is better than cure, we all know. So first isolate the infected animal, cleanliness and hygiene is most important. Then we have to avoid the contact of infected animal with healthy animal. Then we should provide balanced ration, so animal will be don't go to immunocompromised condition. Then spray acaricide in enclosure at regular interval. Caution: the palm of the hand and between the finger. The person should wash his hand when it handle the healthy animal after treating the disinfected animal. So these are the preventive methods. You can see how spraying in this picture using these acaricides. Then these are the some studies conducted for this treatment and preventive purpose, like some phytochemicals of the plant. Many plants is used. In one study, Azadirachta indica herbal formulation of neem is used to treat this animal. Then next we move to the camel pox. Camel pox is, we all know, it is a viral disease. It is highly contagious in nature, and it causes high mortality and morbidity. Mostly affect cows, but sometimes adult camels. Outbreak usually in winter and early rainy seasons. It may be mild or severe, depends on the infected animal's immunity. And then, as we all know, like other animals, once, and human as well, once it is recovered, it will be immune from the disease for life. These are the some study about the camel. It is caused by camelpox virus. Genus is orthopox virus, and family is poxviridae. Transmission is direct and indirect contact, like other contagious diseases, directly from infected to healthy, and indirect contact through contaminated objects. So regarding clinical signs, like in human chickenpox, the formation of different clinical lesions are similar to human pox, like this chickenpox. Two distinct forms is there: milder and localized, and severe and generalized. First, fever and depression will occur, then anorexia. And when we talk about the skin lesion, first small red pimples will be formed, then papules, and papules will convert into vesicles when pus and other bacterial infection will happen in that vesicles, and then pustules, and finally scab. These are the process of forming different lesions. Alopecia, these are, and in chronic condition there may be a due to immunocompromisation and infection with secondary bacterial infection, there may be septicemia, and finally death may happens. When we talk about the diagnosis, first is the history and clinical sign. Based on the history and clinical sign, we tentatively diagnose this disease. Then next one is most important for any diseases. If we talk about this for any disease confirmatory diagnosis, it is important to isolate the infectious agent. If we don't isolate, then there is no confirmation of any disease. So isolation of any infectious disease is important to confirm the disease. So virus isolation is most important. And then serology, like using ELISA and PCR, real-time PCR. These are the some methods. And for differential diagnosis, there may be a use of transmission electron microscopy. From this, we can morphologically identify which virus is there. And differentially diagnosis from diseases like contagious ecthyma, contagious skin necrosis, ringworm, mange. This picture is showing transmission electron microscopy image of camelpox virus and ORF virus. How we morphologically using electron microscopy diagnose these both disease and differentiate. So some studies in India as well conducted regarding isolation and characterization of Indian isolates of camelpox virus using gene C18L. So camelpox treatment, as we know, for viral disease there is no treatment, only symptomatic treatment is available. So if to prevent the secondary bacterial infections, we should use antimicrobials or antibiotics. Antihistaminic we must use like that uh, to control the irritations and other these inflammations. NSAID to control fever and inflammations. And for this wound like lesions, antiseptics like potassium permanganate, boroglycerin, zinc oxide, povidone iodine can be used for skin lesions for local applications topically. Then for preventions like mange, we must isolate the infected animals so we can stop the spread of this disease and transmission to other animals, healthy animals. Then vaccination. In India, there is no vaccination is carried out for this disease, but in some countries they are using vaccination because population is very less. So industry is not interested to take up this vaccine sector, specifically for camel. Cleanliness and hygiene is important for any disease to prevent. Then avoid contact with infected animals. Balance ration, it is important so the animal will recover from the disease through getting its immunity. Then traditional vaccination, some people are using traditional vaccination. They collect scabs from infected animal and keep them in a colored bottle in a cool place. Early in dry season, grind the scab and dissolve them in milk and prick the lip or nose of healthy calves and rub the milk mixture into the scratches. So they will get immunity using this rough method of vaccination, like named as traditional vaccinations. Next disease is camel contagious ecthyma, or it is also an important disease. It is mostly the primarily disease of sheep and goat, but it also occur in camel. It is locally known as mumdi in India, in Hindi. Highly contagious skin disease, acute fox-like disease, mostly affect calves of less than 1 year age. In early rainy seasons, sometimes it affects adult camels. Disease animals lose conditions and have pustule on lips and face like orf. The difference between orf and this camel fox is one most important difference is in orf lesions are mostly present in mouth area. So this lip commissure or like that. So orf does not usually kill camels. Morbidity is high, but mortality is very less. Recovered camels remain lifelong immune. Then in case of contagious ecthyma etiology, it is caused by camelpox virus. Genus is Parapox. But in uh, camelpox disease, the genus is Orthopox. But in contagious ecthyma, genus is Parapox. This is one other difference between both disease. And transmission is direct and indirect. Direct from infected to healthy, indirect through contaminated object. Predisposing factor, small injury on the lips from browsing on the thorny trees make it easy for the disease to infect. If skin is intact, then calf will not get this infection, but any injury on the lips will happen. It is a most important predisposing factor to get this virus inside the skin, and ultimately it will cause contagious ecthyma. When we talk about the clinical signs, uh, first sign appears is depression and fever, then anorexia, then pustular lesions and nodules around the mouth, lips, buccal cavity, and swelling of the head. Others clinical lesions on the skin will similar to the previous disease. First appears pimples, then papules, blisters, vesicles, and then pustules, and finally scabs. But one most important difference in both diseases, in case of contagious ecthyma in camel, there will be a submandibular edema you can appreciate in this picture, and lacrimation. Due to this edema, animal will be unable to masticate or graze. So due to this pain, anorexia will happen, and ultimately weakness and production will be lost. And usually lesions will heal its own in 3 to 6 weeks. But if they will get secondary bacterial infection, then there may be a septicemia. When we talk about the diagnosis, similar to previous disease, camelpox, the diagnosis is similar through history and clinical signs. Then virus isolations using cell culture method. Then serology, ELISA, PCR, RT-PCR, transmission electron microscopy. These are the common methods to diagnose this disease, and differential diagnosis with similar disease like camelpox, contagious skin necrosis, ringworm, and mange. When we talk about the treatment for viral disease, there is no specific treatment, only symptomatic treatment is used. Antibiotics to prevent secondary infections, antihistamine to control the severe irritation and itching, NSAID to control fever and inflammations, and for skin lesions, antiseptics like potassium permanganate, boroglycerin, zinc oxide, povidone iodine. And then calves are encouraged to suckle, so they will get some nutrition and immunity. If there may be a chances of getting maggot wound, then we must treat the maggot wound as well. For prevention, isolation is most important. Isolation of infected animals. There is no ORF vaccine specifically for camel. Some claim SIP vaccine is effective, but others say this is not effective. So for camelpox and ORF, there is research is ongoing to develop the specific vaccine. Cleanliness and hygiene is important. Then avoid contact with infected animal, balance ration, and traditional vaccination as we discussed earlier. So regarding lumpy skin disease, only one report from India is reported for this lumpy skin disease. There is similar to cattle, the lesions, skin nodules developed in camel, which suggested lumpy skin disease virus infections. So anti-LSDV antibody in serum is also confirmed. Phylogenetic analysis suggested it is a strain like lumpy skin virus Kenya strain. Then contagious skin necrosis. It is a bacterial skin disease caused by staphylococcal bacteria causing dermatitis. In Rajasthan, it is known as foda. Camels frequently suffer from skin necrosis, especially in crowded condition. Affects camels of all ages, although young are more susceptible. Etiology, as we talked, bacteria and fungi both are causing this, mostly bacteria. Actinomyces, Corynebacterium, Staphylococcus, Streptococcus. These are the common etiological agent for this skin necrosis. Transmission is direct and indirect contact. When we talk about clinical signs, painful skin lesions is there in case of skin necrosis. Its name itself suggests skin necrosis. There will be necrosis of skin cells, mostly on neck, shoulder, wither, and quarters, and legs. Alopecia on the lesions site, and then camel will try to rub and bite this sore, so they will cause mechanical injury, and then wound will be open and dead skins come off. So this is another sign of this skin necrosis. Circular ulcer that does not heal, and then ultimately septicemia, which may aggravate these conditions. Then when we talk about the diagnosis, history, clinical signs, bacterial and fungal isolation is most important. As I earlier told, that for any disease, confirmatory diagnosis is not a serological, molecular, any method. None is confirmatory. Only isolation of infectious agent is confirmatory method for diagnosis of any disease. Other methods, when we say that OIE recommended method, they are the most uh, practical method, or that method is having specificity or sensitivity higher with all available diagnostic methods. That's why we recommending OI recommending that this method is easy, cheaper, and specificity and sensitivity is higher. So that method is recommended by OI for diagnosis. Otherwise, the confirmatory test is isolation of infectious disease. Then differential diagnosis with dermatophilosis, ringworm, and mange. Treatment: 100 gram of sulfur powder with 900 gram of Vaseline paste is used. Then first we remove dead tissues, put paste on the sore. Antiseptic can be used on this local application of on the lesion. Antibiotic ointment, broad spectrum antibiotics like long acting oxytetracycline is effective. Symptomatically, we must treat this contagious skin necrosis using antibiotic, antihistaminic, NSAID, and then other antiseptics. Prevention, isolation, cleanliness, hygiene, disinfect fan and surrounding area, avoid contacts, balance ration to camel, add salt in drinking water. Ringworm in camel. Like other animals, dermatophytosis and dermatomycosis is also occur in camel. In local language, da then tat is uh, pronunciated. So mainly camels less than 3-year-old is affected. As many as 80% of young camels in herd may be affected. If one camel is affected, means it is highly contagious. Reduce the animal value, but not its performance. Usually heal by itself. Genetically, it is important, but not dangerous. Etiologically, fungus like trichophyton and microsporum is responsible for ringworm disease in camel. It is spread slowly, direct and indirect contacts. Fungus spore may survive for months outside the this disease. Fungal spore remains outside for months. So to treat the fungal disease, it is very difficult. Clinical signs mostly dry, hairless, and circular patches on the skin. You can appreciate in this picture. Then head, neck, shoulder, legs, flanks are mostly affected. These patches do not itch. Itching is not present in this ringworm compared to men's. In men's, there is very severe itching. Camels normally recover without treatment. This is a trichophyton ringworm in this picture. Characteristic lesion of ringworm like coin-like this patches of white crust you can see in picture. Then diagnosis, history and clinical signs based on skin scraping. We can see on slide this fungus morphologically we can identify. Then fungal isolations using media suitable for that particular fungal. Then differentially diagnosis from disease, similar disease like dermatophilosis, Mann's contagious skin necrosis. In treatment, it is normally not necessary to treat as it's heal automatically itself by the calf when they get older. But for temporary relief, we must wash these patches with soap and water or any antiseptics, iodine solution, and tincture iodine and glycerin 50-50% we can use. Then spray like and this topical antimycotic agent also we can use like mycostatin. Graciopulvine can be used in other animals for treating ringworm is not recommended for camel because it may have side effect in case of camel. Graciopulvine is not used. Then prevention, like other disease, similar to other disease, all are same. So I'm not going to read here. Then next disease is skin candidiasis. It is also a one most important disease in case of camel. It affects young camels less than 1 year old, mostly because old camels are adult and old are immune to this disease. Locally, it is known as Tickeria. I will explain why this Tickeria name came. It is highly contagious and zoonotic in nature. Fungus causative agent is fungus Candida albicans. It is spread rapidly by direct and indirect contacts. One camel calf is affected, it will spread to all camels because camel in hard day, all camel calf remains close in close contact with one another, so it will spread. Then next, when we talk about the clinical signs, you can see in picture small circular lesions in the back near hump and abdomen, large and spread. Finally, it is spread to entire body. You can see small circular lesions, white and pustular and hairless. Hide fibrous layer will develop in chronic conditions. When we scratch these lesions, foul smelling, black, brown, hairy scrap come out. Calf will remain restless and it will cause itching, and they become weak and thin due to anorectic conditions and continue doing continuous itching. When we talk about diagnosis based on history, clinical sign, and skin scraping and fungal isolation, these are the most common methods. And differential diagnosis: ringworm, dermatophilosis, Mann's contagious skin necrosis. In treatment, antifungal, and we must apply antiseptic on the lesion first after removing the scab and hair. 2% potassium iodide solution is effective. Then 6% sulfur powder in mustard oil, it is also very effective in case of candidiasis as well, like in mange. Then inject long acting antibiotic to prevent the secondary bacterial infection and apply topical antimycotic agent. Prevention, isolation, cleanliness, hygiene, disinfect fan surrounding, avoid contact, and allow calf to suckle so they will get immunity. Wash your hand well before handling other animals. Use gloves applying medicines. Next disease is dermatophilosis. It is a bacterial skin disease of camel. Metalled and encrusted hair is the most common sign. It also affects mainly young camels, rarely adults, and it is also zoonotic in nature. Etiology: fungal-like bacterium Dermatophilus congolensis is responsible for this disease. They spread slowly, but by direct and indirect contacts, mostly found in rainy seasons. When we talk about clinical signs, swollen and red skin begin to weep in fluid-like secretion. Fluid dry, forming a crust. Then when we remove this crust, reddish area that weep a thick bloody fluid will be the most important clinical symptoms. Mostly base of the neck and flank and leg regions is affected. Diagnosis is based on history, clinical sign, skin scraping. We will do gram staining. We can identify this bacteria in gram stain. Then bacterial isolations using suitable this cultural media. Differential diagnosis with similar disease like ringworm, mange, contagious skin necrosis. Treatment usually not necessary. Heals in 4 weeks without treatment. So we apply the antiseptic on locally on the lesion. Long-acting antibiotics to prevent secondary bacterial infection. Topical antimycotic. Iodine solution is used. Then for prevention, similar to other disease, isolation, cleanliness, hygiene, disinfect fan and surrounding, avoid contact, balance rations, use gloves, wash your hands. Some other dermatological problems and other camel disease problems is also there. I'm not going in deep on that. Only just this like skin tumor, bite, wound caused by insect bite. During rainy season, there is a severe fly infestation is there. They cause allergy in camel. Also, due to this stomoxis and tabanus fly, they cause trypanosomiasis, SARA. SARA is very important in case of camel, which is caused by Trypanosoma imanzi. I did not include it in this slide, but I will explain little bit. This SARA is known as SARA means SADA. It is a chronic disease in camel, 3-year disease. It is known as Tibarsa. So once camel is infected with this Trypanosoma ivanzi, and they will cause, as we know, it is a protozoa, hemoprotozoa, which is present in blood. It is easily identified using this gym size 10, thin blood smear or thick blood smear, wet smear. We can see also in wet smear this Trypanosoma. And for Trypanosoma, diagnosis is not a difficult task. In camel, it is highly fatal disease, which is causing high mortality in case of camel. So, like equine, it is also important in equine trypanosomiasis. In all animals, trypanosomiasis is caused by Trypanosoma ivanzi, mostly the SARA. After diagnosis, treatment is using this quinapyramine sulfate and chloride. So in camel, what we are doing is prophylactically before rainy season, we are giving this quinapyramine sulfate and chloride combinations, so they will not get this infection. During rainy season, this tabanus and stomoxis fly will increase, and they will responsible as act as a vector for this transmission of this disease. This is an example of saddle sore, saddle gall. As you know, camel is mostly used for broad purpose to carry the camel cart. So saddle is on this hump. You can see in camel hump there will be this saddle sore will be developed in chronic conditions. It is just a mechanical. It is very painful. So antiseptic will be applied on this. Then dermoid, you can see in this picture. Dermoid cyst is developed in neck region of camel, foda and made. It is not contagious, but although it is a painless growth on ear and neck, spoil the look and lower its value. Treatment is not necessary because it is harmless. Then skin abscess or chest pad abscess. In camel, there will be a in ventral abdomen, there will be a chest pad. Sometimes abscess will develop on this due to bacteria, any thorn or sharp lesion or cut due to cut, abscess will be developed. So it is painful, inflamed swelling, and location anywhere in the body, but mostly on the chest pad. So treatment is first we must drain out the pus and remove dead tissue, then flush with 0.1% solution of potassium permanganate, and we have to apply antiseptic on the pus, this abscess area. Thank you very much. These are the most major common diseases and their clinical symptoms, their etiology, and their treatment.